Good morning, it's Rachel Carroll from the Neuromuscular Studio. I just wanted to talk real quickly about one of the major muscles that causes lower back pain that a lot of people don't realize is a major contributor to lower back pain. And that muscle is called the psoas. You may have also heard it called the iliopsoas. Iliopsoas means there's a connection. It's referencing two muscles, the iliacus and the psoas major, that start in two separate areas and are two separate muscles, but then join into one insertion on the femur. So we generally treat psoas, also iliacus, from time to time. But the big thing with lower back pain, most people don't realize, is that the psoas muscle actually attaches to the front side of the lumbar spine. And so when that psoas muscle becomes tight, its primary action is hip flexion. So it brings your knee up towards your chest, or it flexes and hinges the hip. So when that muscle tightens and contracts, it can actually pull on the front side of the lumbar spine and then pull that those anterior vertebrae forward, and then create tightness in the posterior spine, or what you're seeing as the lumbar spine. So it's very, very important that if you are having, if your back goes out, you throw your back out, your lower back locks up, your SI joint locks up, very, very important that psoas is treated as a part of your treatment plan. I'm going to show you a little bit. I'm going to use this visual. Okay, so big shout out to 3D for Medical. They are our education software for massage therapy and for muscles. So you can see here, psoas major comes down here from the anterior spine. Let me rotate the body. Okay, so you see it from a side view, and you can see here, it's on the front side of those transverse processes. So really, really thick muscle. Comes down all the way and inserts into the top of the femur. And then this section right here is that iliacus muscle, which is on the inside of the pelvic bowl, which is a stabilizer. And then they come and they join and they insert into one spot. So this is iliopsoas, the two. So psoas major, again, see that? You can see from a different angle how thick that muscle is. So when you bring your knee up towards the chest, this muscle tightens and contracts. It can pull that lumbar spine forward, and then what you have is all of the muscles, your spinal muscles on the posterior side, have to compensate, and they tighten, and that's where you feel the pain. So that is a huge part of lower back pain. Also, trigger points. Going to our Referral and Simon's manuals, which are kind of the quintessential manuals for neuromuscular therapy. So again, here's the psoas major and the iliacus. And here is your trigger point referral pattern. The trigger point referral pattern for psoas, trigger points being here and here, will refer into the anterior thigh. And then also behind, more in the erector spinae lower back area. So you could feel the pain here, and you could feel the pain here. Sometimes also there's a referral into the abdomen, but the actual trigger point is coming from, the source of that referred pain is coming from the trigger point in the psoas, or even the iliacus. So anyway, just in closing, it's really important that if you are having lower back pain and you're seeking massage therapy, that you're working with a therapist who understands the psoas connection with lower back pain. And not every therapist, maybe they learn it in school, but they don't practically apply it. So very, very important that you work with someone who is experienced in that. And with neuromuscular therapy, we work with it on a very regular, daily, multiple times a day basis. So if you have any questions, let me know. Again, I'm Rachel Carroll. I'm the owner and founder of the Neuromuscular Studio, and you can contact us. Check out our site, nmtstudio.com, or you can contact us 480-967-7345 with any further questions. Have a great day.